Welcome to our In Perspective series, where we provide an in-depth look at the prevailing challenges we're facing today. I'm your host, Beth Goldsmith, Chair of the Board of the Associated, and I'm delighted that you will be joining me. Throughout this year, we've been speaking with local and national experts about the global issues facing our world. During these intimate conversations, we've looked at how the Associated and its network of agencies, thanks to the support of the annual campaign, is getting ahead of the curve to address the issues in innovative and forward-thinking ways. Today, we are facing two major crises in our world. Unfolding before our eyes is the ongoing horror of the invasion in Ukraine. The Associated is working with its overseas partners to address the mounting humanitarian needs, including food and shelter and emergency medical units. And second, since the start of COVID-19, depression, anxiety, substance abuse, and other mental health issues have soared. Today, 1 in 5 adults in our country experience a mental illness. Meanwhile, in December, the U.S. Surgeon General issued a rare report warning about the devastating mental health effects the pandemic has had on our youngest people. The report found that emergency room visits for teen mental health increased 31% since the start of the pandemic. And in Baltimore, 55% of Jewish young adults reported they were experiencing emotional or mental difficulties that adversely affected their daily lives. Today, we're going to talk about this mental health crisis, how we're addressing it, and the critical need for additional funding. Here to start the conversation is Trisha Stern, Vice President, Child and Adolescent Mental Health Services, Network of Jewish Human Service Agencies. And following our conversation with Trisha, we'll hear from 3 of our agencies, Jewish Community Services, the JCC, and Maryland Hillel, about what they are seeing on the ground. I want to remind everyone to submit any questions you have for our guests through the Zoom chat. We should have time to address a few questions toward the end of the program. So let's start. Trisha, hi and welcome, and thank you so much for being here.
Hi, Beth. Thanks so much for having me.
Can you start off by telling me about your organization and your role, and why was your position created?
Yeah, thank you. So as you shared, I'm the Vice President of Child and Adolescent Mental Health Services for the Network of Jewish Human Service Agencies. And the network is an international membership association of more than 150 nonprofit human service agencies in the US and Canada and in Israel. And my role was recently established to direct the network's partnership with the Jewish Federations of North America to lead what we're calling the Resiliency Roundtable Initiative to try to meet the increasing mental health needs of youth, young adults, and parents, both through intervention and prevention. And my focus is to try to work with member agencies to strengthen their capacity to be able to provide mental health and related support services to youth and parents, and also to work with Jewish education and engagement organizations to help them better address the mental health needs of youth and parents in these settings. The goal is we really want to bring together both the Jewish clinical and the engagement worlds to create cross-sector collaboration.
Sounds good. What have you seen happening nationally these past 2 years?
Well, children, youth, and young adults were already struggling with their mental wellness before the pandemic began. We were already concerned. Youth had been reporting persistent feelings of sadness and hopelessness, loneliness. Many reported experienced major depression, anxiety disorders. We're actually seeing anxiety disorders starting even earlier at age 3. And unfortunately, we were seeing increasing rates of thoughts about suicide and actual suicide attempts. So we were already seeing this concerning trend. And then, as you were mentioning, the pandemic made the situation all the more challenging, with youth lives being upended and having to deal with isolation and loss of routines and important milestones. And now the data is really showing alarming rates of mental health needs, with significant increases, as you were saying, with anxiety, stress, depression, suicides, and as you were mentioning, that increase in emergency room visits. And we are seeing that as young as 5-year-olds. We're seeing increases in eating disorders, substance abuse, acting out behaviors. We know that children and teens have fallen behind academically, which causes stress, that it's been very difficult socially for them, and that they've been separated from their community at a time that they really needed human support and connection.
Indeed. What do you think might be long-term effects for our communities?
Well, the child psychiatry department at New York Presbyterian Hospital is calling this the Generation U for uncertainty, because of all the uncertainty that this generation, these youth are having to deal with them, and sort of all that's going to happen to them. And, our human brain hates that. So our brains are wired to perceive threat, meet it, and then have it come down. And so before the pandemic, there were times when our brains could go on more on autopilot and not have to be alert all the time for possible threats. Now we really don't have that anymore. So for instance, I'm assuming this might be true for you as well. When I would go to the grocery store before the pandemic, my brain could go on autopilot, or it could be task-oriented on what I needed to get, but my threat detection system was not active. However, now something like that, something that used to be so automatic, now my threat detection system is activated. I have to think about my safety. And that leads really to chronic stress and really chronic trauma, because now there are such few times or places when our brains don't have to be on guard. And this is even more pronounced for youth for many reasons, particularly because their brains are still developing. And they don't have as many of those automatic brain experiences as adults that they can pull from as a resource. And because the typical experiences of their development, being at school, with peers, with extended family, now all has some risk connected to it. So I think we're going to really need to approach this like chronic trauma. And I think we can draw from models that have been addressing chronic trauma, like living in homes with abuse or violence, or for veterans. Yet we're going to have to really expand that approach, because it really is about collective chronic trauma. We've all experienced this. So for youth, their parents are stressed, their teachers are stressed, their coaches, their clergy, the religious school teacher, camp counselor, and so on.
Yeah, I joke with my son, I shouldn't say joke, but often that it isn't PTSD because there's nothing post about it. Right. Because it's ongoing, because it's ongoing. So tell us what you're trying to do to help local communities deal with the crisis.
So really what we're trying to do is a lot like what we're doing here. We're trying to address that collective chronic stress by supporting local communities to really bring together, as I was saying, both the Jewish clinical and the Jewish education and engagement worlds, to have more of a coordinated response that really brings awareness, normalization, and validation about how youth and families are feeling, and finding ways to provide an array of services. So we want to both address the clinical interventions, but we also want to make sure we're having programs and services that support well-being and really normalize that, it's important to prioritize our mental well-being. We all have mental well-being, and we need to promote it and take care of it. And we want youth and families to know it's understandable if they're struggling. It's okay to name that and ask for needed support. And we're also working to make sure the help and support is there for them. And as I said, we're wanting you to know the importance of of taking care of their mental wellness, and really making sure we have programming that addresses that.
Okay, I'm going to wrap up with one last thing for you before we move on with our program. Is there anything we've learned that maybe we could call a silver lining in these last 2 years?
Yeah, I mean, it's hard to, say there's a silver lining to the pandemic or with the youth mental health crisis that we're seeing, but there really has been. And I think one of the major silver linings is the realization by so many, I think maybe all of us, that mental health challenges are not something that only a few people over there in the dark, in the quiet, in the secret are dealing with. There's really so much more awareness now about how mental well-being can be impacted and how it has been affected during the pandemic. And I really see and hear a desire, so many people wanting to better understand what youth are going through and trying to support them. And I've seen that in all settings, families wanting to better understand, schools, funders, the government. You mentioned the Surgeon General releasing that report and really focusing on youth mental health as a major public health issue. And I was able to attend a hearing virtually of the Senate Finance Committee. They're really working on a bipartisan effort to address youth and their mental health and well-being. I think something else we've learned is that trying to talk people out of their feelings or convince them otherwise, or telling them to just focus on the positive really doesn't work. We've known that through neuroscience for many years. We've known that the brain really needs our feelings and challenging experiences to be named and validated, so then it can move towards growth. But it's good that we're now seeing society catch up to that.
Thank you again. Thank you so much for your expertise, and thank you for being here. And we're going to see you a little bit later on in the show. Before we meet our next guest, though, I want to share with all of you a conversation I recently had with 4 high school students who currently participate in our Forefront teen programming, which is housed at the JCC. They represent a cross-section of our community, and they spoke quite candidly about what the past 2 years have been like and the challenges they have faced. We're here to talk about how the pandemic has, I guess, changed your world and certainly impacted your high school experiences.
I was hoping to enjoy my first 2 years of high school before, like the stresses of college started to set in. But with, COVID and everything, we went virtual, kind of had me missing out on a lot of staple traditions at my school.
So for me, the past 2 years have been very stressful and like a little lonely because we weren't able to see many people.
Sitting in your room on like a Zoom call isn't very exciting, and it doesn't really give you the motivation like getting up and going to school does, getting up and hanging out with people.
It's really hard when like you're not seeing your friends every day, and it definitely like taught me how much I need like human contact and to see people.
Tell me about your anxieties over this world you've been thrust into.
I definitely felt a little anxious with I guess just interaction. Like, what if I forgot how to, talk to people? Like with Zoom, if like the conversation ends, you just log off. But when you're with someone else, you have to sustain a conversation.
I had like different guidelines as far as like how strict and like what I could do COVID wise with my friends. My parents were pretty strict. I felt like I was missing out on a lot of things.
What's that one thing that you're really bummed that you missed?
I go to a sleepaway camp over the summer, and the first year COVID hit, it got canceled. And we did get to go this year, but there were so many restrictions, like we had to wear masks, we had to stay within our group.
We had prom last year and it was canceled. So I'm hoping like there's no variant coming out again that's gonna ruin my senior prom. And if not prom, it was my entire like indoor and outdoor season of track getting canceled.
So my school provides a trip to Spain if you're interested. And that's a big bummer for me because it was something that I saw my sister go through. And an experience that I really wanted to have.
Mine was probably just missing out on my whole junior year, because like all of last year I would have been doing college visits. Now I'm like scrunching them into a certain set period of time. There's a bunch of aspects that went into my junior year that I would have liked to have so that I would be prepared for my senior year in my future.
What would you like adults to know about your generation?
The pandemic is like draining your capacity to pay attention. It's very hard to be alone throughout the pandemic and like deal and still have school on top of everything.
You don't get to see how we are. A lot of us are very much shy when it comes to these Zoom meetings. I don't even know if it seems like it. I'm a very outgoing person. You probably can't see that on a Zoom call. So it's just that we're a lot different than it seems online, and that our personalities are all different. Everyone's going through something else.
A lot of kids who transferred to my school, for example, they were kind of isolated. They weren't able to have those little moments in class. They weren't able to build those bonds. So, and now that we're coming back and everything's, or at least we're trying to have things go back to normal and rebuild what COVID kind of took away from us.
I would want them to sympathize with us and know that a lot of us have the mental health issues that were touched upon and stuff like that, and just accept us for who we are.
This has been such a pleasure and a privilege to talk to you all. I thank you so much, and I wish you all the best. It's clear the impact of restricted gatherings, remote schooling, missed milestones, and more have had on these teens. I'm being joined now by Joan Grayson Cohen, Executive Director, Jewish Community Services, Emily Stern, Chief Program Officer, JCC of Greater Baltimore, and Rabbi Ari Israel, Executive Director of Maryland Hillel. All three of them have been on the front lines of the mental health crisis, seeing firsthand the impact the pandemic has had on our children, teens, and young adults. So let's find out what we've learned. Joan, I'm going to start with you. We just saw that video of what our teens have faced the past 2 years. They talked about loneliness and lost milestones and more. What do we need to be concerned about from their experiences and for other young adults in both the short and long term?
I'm not on mine. You have to unmute me. Okay. Thank you, Beth, for having me on this panel. It's a really important program for our community. And I think the teens that we just heard from really said most everything that's critical for us to know. We've all been living in really a mental health tsunami. And I think short term, we really have to be thinking about for our young folks, what is it going to be like for them to get back to quote unquote a normal life, and especially related to how will they address social skills and interactions. And one of the teens that we just heard from articulated that how complicated it is. They might forget, what to do in a social situation since they've been really working in social media most of the whole time during COVID. And I really appreciated what one of the young ladies said about, do we even know who you are when you're communicating that way? So short term, really worrying about how to get them back integrated into those social situations. Many of our teens and young folks have addressed many mental health issues, anxiety and stress and depression and psychosis. And how do they integrate back into the world with some of those mental health issues? And believe it or not, some of the teens and young folks have actually been happy to be functioning this way, because prior to COVID, they may have experienced social anxiety, they may have been bullied, they may have felt isolated. And so for them, the short-term fear is, how do I get back to a world that maybe actually was not so comfortable for me, and I might have found refuge actually being isolated at home. The other short-term piece for our teens and youth is that they've played roles during this time that they may not have played before. So caretaker roles for their siblings, or for someone who was home in their family who was ill. They may have faced food insecurity issues or financial stressors at home because their parents lost their jobs. So short-term, how do we support them in addressing all of those issues? For long term, I recently read something that I have to share with all of you because it was really so poignant. What it talked about was, for some people, this time will just feel like a disruption, that we had to wear masks, that for youth, they couldn't go to their extracurricular activities, they couldn't go to prom. But for many of our teens and our young adults, they are going to see this time as when their world unraveled and became so critically different for them. And so long term, I really think we have to help them navigate what has been so different for them, again, using social media as relationships, but now having to figure out how to engage in person and hopefully healthy relationships. Also long term, I know Trisha spoke beautifully about what happens to our brains during chronic crisis and how that affects us. And we have to really be thinking about, for long term, some of these teens and young adults, that these issues for them might become chronic now, not just go away when the pandemic is over. And also, one of the young ladies in the video, she talked, if you remember, about, do people see her the same way when she's on Zoom and she seems shyer? Well, long term, what has this done to young folks' images of themselves, their self-images? And then the last piece is, everyone has really been living in a stunted development. And 2 years have gone by where teens and young adults, mostly affected, have really not been able to grow in ways that they normatively would have. And so long term, how does that affect the way they engage with the world and in relationships?
Thank you, Joan. So much to think about, really. Thank you for putting that all together for us. One of the teens actually mentioned camp. And Emily, I'm going to turn to you. What are you seeing and how are we addressing it?
Yeah, well, once again, thanks for including me as well in this really important conversation. And, as the Chief Program Officer at the J, I've been our Senior Director of Camp for the last many years. And last summer, we served over 1,000 campers, and 150 staff members were a part of our camp platform. And we saw a lot in the realm of mental, emotional, social health, and how just this pandemic has affected young kids from the age of 3, as Trisha mentioned, that what we were seeing in this realm is starting younger and younger. That was pre-pandemic, and now we're seeing it even more, all the way up through our teens and adult staff. So the teens that we just heard from in camp are actually some of our people that are actually in charge of the young campers that come with us. So they're dealing with their own mental, emotional, social health and well-being in the areas that Joan and Trisha just spoke so eloquently, that the teens spoke about. And then on top of it, having to take care of others and young children that are going through their own issues in some cases. And really last summer, what we saw was a higher, frequency, volume, intensity of all of the things that were already mentioned. And what we really realized is how much there is a need for a proactive approach to being able to help our campers and our staff to be able to help them through all of these things that we're seeing from, they jumped developmental milestones. We've been talking about this already. The kids jumped developmental milestones at home without a lot of feedback outside of their families. Many have supportive homes, some don't. And without that feedback or that, regular feedback, we just saw that come out in a variety of different ways, from social anxiety to just being able to interact with each other, to physical aggression, to anxiety, to depression, to more adult language, which was an interesting one. And then our young staff needing to be able to help them through that and not having the tools. So being able to figure out how can we be proactive in helping our camp community and our community in general. How can we be consistent in that practice? How can it be clinical? We don't have clinicians in camp in the way that we would like. And so being able to bring that camp care to our community is something that we're really looking to do this coming summer. And it's so important now more than ever. So it was a summer that was something that we, knew likely we were going to see a lot more of this. It was more than we had ever anticipated. We had kids that were entering what would be considered our third grade program, and their last typical year of school was kindergarten. And we saw that come out in all of the ways that I just mentioned. And the teens missing those milestone years in camp of being a counselor in training were missed, and jumping right into being counselors for the first time. So all of those things had pretty extreme effects, and ones that we are looking to address this coming summer in support, because we know that's what they're going to need. It's another person already mentioned, it's not about talking them out of their feelings, it's validating their feelings and helping them through it and supporting them, and giving them, not only the staff and the campers, all those tools.
Well, there's so much to understanding the complexity of this, the impact of all of this. I'm going to turn to you, Ari, to talk to us a little about what's going on at the college level and how are we supporting our students there.
Thank you, Beth. Thank you for the associate and my co-panelists for really bringing us together and enabling us to grapple with such a critical topic that unfortunately we don't talk about enough, and unfortunately we need to. And it's a wonderful opportunity. As Trish shared the data so eloquently at the beginning, anxiety and depression numbers are sadly trending up. Increased needs for counselors on campus and therapists, overloaded waiting list centers. It just can't get an appointment. And universities are spending a lot more resources, and still need to spend a lot more resources on meeting the needs and the growing needs that are happening. It's my 26th year working at Hillel, and it's been a steady climb up. And even myself, I need more training and learning how to put this all together. All of this is pre-COVID, and it's still continuing. As an aside, some of the academic and research studies have indicated that the numbers have not shifted as radically as some of the stories are out there. COVID itself is really not the pivot point. Although the recent 2021 data from the fall, just from December, is not out yet. But I have looked at the research from 19 pre-COVID to 20, that first year of COVID, and the numbers have not increased strictly because of COVID. They've been climbing steadily in before. And there are a lot of reasons for these trends. Could be a breakup of a partner, loss of a grandparent, pressure to succeed. Our students just in school, starting in high school and getting into elite college and continuing with those grades, and job and grad school. Students don't have breaks. Their time is sort of shifted, and family expectations, social anxiety, and so many other factors that are contributing to this. One of Maryland Hillel's last in-person programs in our building in the spring of 2020 was a program that 5 students came together and reached out to me, and they shared openly that they were survivors, all of them, of attempted suicide. And they thought that it'd be important to reach out and create a program called Out the Stigma. And we had well over 100 students present, listening to their stories, learning from each other. And we just scheduled a new program this semester to continue that trend. We're in person here in College Park. And our message is to think about the individual within the midst of building community, letting students know that they're not alone. Staff training is critical, and we need to continue to sort of enable our students to and our staff to learn. Many of our staff, frontline engagement staff, are not any older. They're maybe a year or two older, and throwing them to the lion's den is critical. And universities are spending a lot of time and resources. Just 2 weeks ago, I participated along with 60 other campus professionals. I was me and one other Hillel colleague were the only Jews in the room, or at least Jewish professionals in the room, and it was an all-day seminar on suicide prevention. So the university is taking this seriously, and we need to spend those opportunities to really think about it. We've also had initiatives such as TLC, Tender Loving COVID Care Packages, which has distributed well over 500 packages, recognizing that students in isolation should not be alone. And we want to make sure that they know that we are there and we check in on a regular basis. And it's not just the one moment in time. It's not just that one pivot time that a trigger event happened, but what's the residual effect that many of my panelists were speaking about? What's the long term, the short, the medium, the long term? So to remember to check in. And I just want to proudly say, and the Associated should really continue to be proud of the work and investment that they're doing, that because this topic is so critical and my colleagues across the country are grappling with this, the Associate has invested in mental health, wellness and awareness. There's a Shabbaton taking place at Pearlstone next Shabbat with 50 students and staff members from our 5 local universities, all getting together, talking about these issues. And it's thanks to the Associate's support that is enabling us to do that. So, this is critical and it's time sensitive. And we are making a difference to the best of our ability, one student at a time. And unfortunately, there's just a lot of need out there.
Wow, how very brave of those students who came forward, and how heartening, I will say, in the face of so much disheartening information, to know that there are answers, there are positive ways to move forward. I'm going to go back to Joan. We've talked a lot about things that the mental health challenges that have been sparked by COVID. What about the people who were facing mental health challenges before?
So Beth, that's a great question. And one of the things I want to start my conversation with you is something, Trisha, you brought up, which is that now we all have a whole different appreciation for those who suffered from mental illness before the pandemic. And it was always easy before to say, oh, it's somewhere else or somebody else is struggling with this, but we've all experienced something around mental wellness. So I do hope you asked earlier, Beth, about a silver lining. I hope that is one of the silver linings that we'll continue to keep, which is that appreciation for those who were suffering before the pandemic, because it really escalated it for them. So we see many cases where people had anxiety and depression and other mental illness issues prior to the pandemic, and it has just escalated their ability to address those issues. It has decreased their ability to function. We have continuously throughout the pandemic had a waiting list of services because the numbers of folks who need assistance is just so great. We've seen a rise in suicide ideation and suicide, especially among the population that we're speaking of, and certainly a rise in substance use and abuse because people self-medicated during this time just to get some relief for what we were all experiencing. And again, I go back to what might sound like an irony, which is there were folks who got a reprieve during this time, though. So they came into this maybe with severe anxieties around social interactions, social anxiety, or agoraphobia, or germ phobia. And when they had to stay at home, they were forced to stay at home. For some people, it was actually a relief. And the worry is when they go back into the community and they go back into structured environments, will their mental illness escalate because of having to experience those fears again? So we can, as I said, we continue to see major rise in requests for services, and we will continue to see that after the pandemic goes away. And I call that period the period of recovery, because we don't know yet what it's going to be like to quote unquote re-enter, what it brings out in people either who had issues before or who gained issues during this time. So more to come. And there's a lot more work to do.
Thanks, Joan. When we talk about our physical health, we're often told, and we think about how we can prevent ourselves from getting sick. What are we doing proactively in the arena of mental health? Emily, do you want to weigh in on that?
Yeah, sure. So at the JCC, we mentioned Forefront earlier, which are the teens that you heard from were a part of our Forefront programs, which is housed at the JCC. And Forefront right now is doing a lot of proactive work to help provide support to teens. And the teens ecosystem, or system that we call it, is really made up of a few people. It's made up of their parents, it's made up of the professionals that work with them, and it's made up of their peers. And so they're trying to look at all three of those areas to help provide support to those individuals to then support their teens. So for parents, it's through workshops in their in a program called Parenting Unpacked. They're actually just about to start a 6-week series where they're going to be helping to educate parents on ways to support their teens and also to look out for signs of distress in any way. There's also giving support to our professionals. There's a program in Forefront called E3, where there's a cohort of professionals that come together to talk about a lot of different things about working with teens and mental, emotional, social health. Right now, as we've all been talking about, is the forefront of that. And by offering the youth mental health first aid course is a really amazing way to get a lot of professionals trained in ways to support teens and to look out for signs of serious mental, emotional, social health issues. And then lastly, their peers, they're the ones who really know them the best. And through a program called the Peer Leadership Fellows, PLF, they were already a part of a program that they were trying to work together to get their fellow peers to be a part of programs that exist already in our programs. And so by giving those teens training in mental, emotional, social health, we're not looking for them to be clinicians, but we're looking to give them the signs and symptoms of things that they can then go and report or to get them support if needed. So by really doing some of those proactive pieces of giving people surrounding teens and surrounding youth the training to then be able to find the clinical support or to start those conversations is so important. And that really is what Forefront is doing right now to help be proactive. Just like with our physical health, you're right, we need to be proactive with our mental health too. And that's just a few ways that the Forefront team is looking to do that with our teens.
It's wonderful to hear about these proactive activities, and opportunities. Joan, did you want to weigh in on that also?
Sure. The clinician in me says you really can't talk about mental health without talking about your physical health and vice versa. So to me, they're always intertwined. And of course, many of our staff are trained in all of these aspects of first aid, mental health first aid, and other modalities as therapists. But we have really looked during the pandemic at all of our programs and focus on really mental wellness and trying to expand the work that we're doing, whether it's our financial wellness, because when you think about your financial wellness, there's stress involved in that. And it is a component of your physical health then. We're doing some really impactful work in our Ignite Career Center with our employers, because employers before have never had to deal with these issues for their own employees. So really helping them be one, alert to what the issues might be for their employees, get them immediately to some kind of assistance. And really, it's a topic, as I said, employers never had to really think about before. At our own agency and across the associated system, there has been a lot of work done around mental health issues, really making sure we are all taken care of as we do this really critical work and thinking about how to support each other in doing that. And we are working with children as young as 2 and 3. We had a really interesting program that we developed, which talks about unpacking feelings and stressors. So they talk to little preschoolers about when you have your backpack on your back, what's in there? And if it's really, really heavy because you have books in there and your projects in there and your lunch in there, but what about if you had your feelings in there and your stressors in there and anxiety? And we started to talk with kids as young, as I said, as preschool age. And one of the little boys after the program, the next day he said to his teacher, my backpack is so much lighter because I went home and I talked to my mom and dad about my feelings. So we know it's working. We know young children can do a lot of this preventative work too. So our staff is out in force from preschool all the way through teens, young adults, older adults, really helping them identify these mental wellness issues and then knowing where to go for the resources.
Yeah,
Wow,
and actually,
I love that unpacking. I'm sorry, Emily, did you want to continue?
no, yeah, I was actually just going to say, because Joan and I are already working together and our agencies are working together on this work that Joan's talking about right now. For camp and our early childhood center, JCS is an organization that we have been working with pre-pandemic, and one that we are leaning so hard into that relationship right now as we go into the summer. So all the things that we've been discussing about the resources and the ways that we can help support our staff to support others, we are doing that in knowing that we need clinical support and we need to be proactive, we need to be consistent. But if we don't have the clinical support and the expertise, then it's not going to go in the way that we need it to. So we are already trying to lean in together on helping to bring that camper care team to the JCC, and especially in our early childhood center where those kids are with us year round. And it's a group of parents that sometimes with your 2-year-old, it's your 2-year-old and you have no idea that it's going on because you don't have any other children around you to know what is considered typical or is considered a feeling that may be too big for a 2-year-old or not. So we're leaning into that relationship already, and one that we're excited to continue working together on.
Yeah, it's great. It's certainly always great to hear about the partnerships and the ongoing communal spirit of what we do. Right before I bring Trisha back, I want to turn to Ari to ask this. Is there anything inherently Jewish or particular to the Jewish community that we need to think about when we address mental health?
Yeah, thank you. I think everything we're doing right here, this whole conversation is Jewish, not just in spirit, but in really following where we're going. You know, the response to panic and anxiety, naming the problem, not shying away from it is such a Jewish approach, asking ourselves, what's the function of the specific emotion that we are experiencing at time? The guilt that a teen may have for not following parental expectations about COVID or about any other rule breaking, the juggling of school, social and COVID precautions. What is this anxiety about? It's a signpost that we care about our families. We acknowledge that and we take a deep breath. And then we hopefully can make a plan to make things better if we work together and acknowledge that moment. I heard from Rabbi Pelkovitz, who's an instructor in pastoral counseling in New York and one of the leading Jewish thinkers on this topic, is that the Hebrew word for love is ahava. Ahav is to love. It's numerically equivalent to the word da'aga, which is to worry. So ahava, love, and da'aga, worry. And they're part of that same coin. It's true that we worry most about the people that we love and the relationships that we care deeply about. To identify the feelings that we have are real and legitimate. One of our team presenters on the video we saw said so eloquently that when a young person is experiencing a mental health challenge, they expect those around them to accept them as they are. And we should encourage them to accept the challenge, to name the challenge, and then to work through it because it's honest and legitimate. The 18th century founder of Hasidic Judaism, the Baal Shem Tov, said, "B'makom shemachshava shel adam sham hu nimtza ha'ish." In the place where we have our thoughts, that is the true person. It's in our thoughts and our feelings that we find out who we are. And we as parents and educators and leaders of the community should do our best to figure out what our students and children are thinking about. As parents, we worry about children and ask, how's this going to impact them? Is this going to change them in some way? And the reality is that the vast majority of our children are very resilient. And as long as we are there for them and expressing care and love, as long as they're adults able to model humility, hopefully the children and teens are going to manage well. The adults have to give themselves permission to be human and to model that for kids. And what we've spoken about today and our challenges, and it's not that there are exceptions or there are rules, that we are all dynamic human beings. Things that we take for granted can no longer be taken for granted. Life is a gesher tsar ma'od. It's a very narrow and fragile bridge. And it's a reminder of this, that life changes so easily and so quickly. The pandemic's been a reminder of the power of being there for each other and for the lonely and for the elderly. And finally, the great 20th century rabbinic giant Rav Soloveitchik shared that it's so healthy to do self-reflection. Happiness levels will increase when we have a vision of who we want to be and where we are going. Writing our values down moves us from the abstract to the practical and the front and the center, helping our students find direction with positive tools of knowing who they are and their identity as a modern Jew and growing young adult. That is the opportunity in front of us. All is not forsaken, and I really believe that there is hope in the midst of the crisis that we find ourselves in.
Thank you. Thank you so much for framing that so beautifully through a Jewish lens for us. I want to bring Trisha back in and ask a few more questions. So I see everyone's back. So let's talk a little bit about what's making it difficult right now for us to succeed. And if you had more money, what would you like to be able to do? And this question's for everyone. Oh, Joan, you start.
Oh, okay, good. I get to start. So a few things if we had more money. First of all, I have to start by saying the power of our system is really remarkable. And so when Emily talked about we're already engaged in partnership to start thinking about how to address these issues, that's really the power of our system. And so money in our system is exponential. And it goes beyond just one agency or one program. It really helps the entire community. So one of the things that's a little new for funders to think about is recruitment and retention dollars. And what do I mean by that? There is a crisis across the country in hiring therapists. And as I said, we have had, and not just us, all agencies dealing with clinical issues have had huge waiting lists. And that's because it's hard to hire therapists and it's hard to retain them. And so if I had more money, I would put it certainly toward that to recruit and retain outstanding staff. Also, we need to, as everyone on this screen has said, expand all of our mental wellness programs, no matter where they sit, whether they be at camps or at the universities or at JCS or at Pearlstone, etc. We need more mental wellness programs to keep people, help them now and help keep them in a mental well state. Also, employers are really struggling, and we need more dollars to help create programs for them. And lastly, I think, Beth, you started this way when you said when you say PTSD with your son, it's not really post. I think that's really a really critical thing for us to think about, because even when the medical aspects of the pandemic are gone, we are in what I call recovery, and it is going to be years and years before we really can get a handle on people's wellness, because we don't have any idea of the extent of the impact of being in this situation and really under siege for now 2 years and maybe possibly more. So I think we have to think, when we think of funding, as short-term, what we need right now, but knowing that these dollars are going to be essential for many years to come.
And Joan, let me also ask you, thank you, and thank you so much for that candor. How is Trisha's work helpful? What can we get? What can we gain our community?
So Trisha's and the whole network's help has been remarkable, because it does a few things. One is it lets you know what's happening across the country. So you're not feeling isolated. You're not feeling like it's only in your community. I have colleagues across the country and in Canada and in Israel through the network that I communicate with to know what are they seeing, but also what are their ideas and how are they making a difference, so we can all learn from each other. That's one aspect. In JCS, we particularly are involved in many initiatives in the network. One is called Project M, where we are working to help job seekers get jobs, but we are part of working with employers also to help them around many of these issues. So there's lots of opportunities on a national level. And one of the things that Trisha is, as you articulated, Trisha, you're trying to do is do many of the things that we do in this community, which, because of our unique system, our associated system, where we are partner agencies, we are not competitors. And the goal is to bring across the country systems like ours so that we can continue to our partnerships, our learning together, our growth, and to be perfectly frank, more efficiency in use of dollars. Because when you partner, then it allows for that exponential gain of any dollars put toward any resource. So the network has been an incredible resource. I'm so excited that Trisha is focusing on this particular population, because I think it's going to have a major impact, not just in Baltimore, but really across North America, Israel, and in Canada.
Thank you, Joan. I know we're getting short on time. Trisha, I want to give you the opportunity to tell us how you want us to benefit from you. And if there was more money, what would you recommend that we be doing?
Well, as I said, and Joan really reiterated this, Baltimore is doing a lot of what we're hoping to accomplish through the partnerships, through creating a coordinated response, not having somebody doing a training over here or a program over here and not knowing what they're doing. And as Joan said, it's really more efficient, and really you get, more for the money when we can have these comprehensive and collaborative approaches. Joan was talking about recruitment and retention. That is a major issue that was also in the Surgeon General's report, and finding creative ways that we can try to retain and recruit new staff. The network, we are going to be offering a training program for clinicians at any stage in their career, because either to have new or early career, or maybe clinicians who work with adults and are maybe curious about working with youth but have never done it, to provide that deeper dive into training, also talking about best practice models, whether that be again on clinical interventions, and, or around wellness, or mindfulness, breathing technique. We have so much research out there on effective programming, and just having that be a coordinated approach rather than just little picking here, little picking there. So I think funding would be great to support, as Joan was saying, that recruitment and retention efforts, maybe even creating a pipeline through graduate schools, to have more mental health providers at our camps, at Hillel and our universities, to really in our day schools, to try and meet youth where they are and give them the support. And as Joan was saying, making sure we're also taking care of the mental well-being of staff.
Thank you so much. I'm so sorry that we are running out of time, and there's still so much to talk about. One of our audience members asked about how the Ukraine crisis, what we're watching morning to night on our televisions and on the internet, is impacting mental health, because certainly I know it's impacting mine. But we do have to wrap this up, and obviously there'll be much more to come. So I want to thank all of our panelists so much for being here today and sharing this with all of you. And I thank all of you for sitting in on the call. The Associated and its agencies have been working tirelessly to address this crisis. It is what we're made for. Joan said it so beautifully, that our partnership and our collective structure works so well for us, particularly in times of crisis. There is so much more to be done. The current mental health crisis requires continued innovation and action. Please continue to support our annual campaign and our emergency campaign for mental health, so that we can help community members who are struggling. And if you know anyone who needs support, call JCS at 410-466-9200. Our next episode of In Perspective will look at neighborhood development and investing in Baltimore City. Look for an invite next month. And again, as I close, all our hearts and prayers go out to the Ukrainian citizens, and we will continue to do what we can to support their humanitarian needs. So thanks again for joining us, and please stay well.